Hey everyone, welcome back to BMS Notes-Simplified, and if you are new here, my name is Dr. Apoorva, and in this channel I'll be sharing with you short and simple notes on different Ayurveda syllabus topics. So this is the next video in the Vatavyadhi English series, so it is about Sandhigata Vata. So in the previous English videos of Vatavyadhi, we have discussed about Arvachin Vatavyadhi types, like the Vatavyadhi types according to modern science and all, and we have also seen Margavarojanya and Dhatukshayajanya Vatavyadhi types. So in this video we will see in detail about Sandhigata Vata. So if you like these audio notes, then please do not forget to like, share and subscribe to my channel. And please remember, when you like a video, then only it shows up in YouTube's algorithm. So I request you to please like the video if you like these notes, and please recommend this channel to your friends and classmates. So let's begin the video. So in this video we will see, if you get the question about Sandhigata Vata for 2 marks, 4 marks or 5 marks or 15 marks, like SAQ and LAQ both types, and also the MCQs, then what all preparation needs to be done, we will see all that in this video. So let's begin the video. Alright, so let's see what is Sandhigata Vata. So there is a shlok here for what is Sandhigata Vata. If the question comes, then you have to write this shlok also. And like I always say, in science, if you draw diagrams, then you get extra marks for that answer. Same way it is in Ayurveda. If you write shloks, you will surely get a little bit of extra marks when you write an answer. So not all the shloks, it's not possible to remember all of them, but some of them you should really try to remember. So like this Sandhigata Vata, it is an important shloka. Just for 2 marks also it can be asked. For MCQs also, one of the words from the shloka could be missing. So I really urge you to learn this shlok by heart. So what does this shlok say? It says Vatapurna Dhriti Sparshaha Shotah Sandhigate Anile Prasarana Akunchanayaho Pravrittischa Savedana. So it's a Charak Chikitsa Sthan shloka. So Vedana at the site of Sandhi, Vedana is pain. So pain at the site of the Sandhi, that is joints, and Shotha, that is swelling. So pain and swelling both are present at the place of the joints. So these are the 2 important symptoms of any Sandhigata Vata. So in day-to-day life, this Sandhigata Vata is known as Sandhivata. So Sandhigata Vata is very rarely said. Usually people call it as Sandhivata. Alright, so let's see what is the Samprapti of Sandhigata Vata. So there are both the types of Sandhigata Vata, Dhatukshayajanya also and Margavarojanya also. So the Sampraptis of both the types are different. So here we will see what is the Samprapti of Dhatukshayajanya Sandhigata Vata. So what happens is, there is Hetu 7, and that Hetu 7 will lead to Vata Prakop, that is Vata vitiation. So Hetu 7 leads to Vata Prakop, and then Vata Prakop causes Rukshata, Parushata and Kharata at the site of the Srotasas. So in the Srotasas there is Rukshata, that is roughness, Parushata and Kharata. So these are 3 important signs what happens at the Srotasas. And then this Rukshata and Parushata, Kharata, it leads to Vayu Puran at the site of Rikta Srotasas. Rikta is empty. So what happens? Vayu Puran is there at the site of Rikta Srotasas, and then when there is Vata Sangha like this, then it leads to Sandhigata Vata. So Vayu Puran happens, and then Vata Sangha. So first of all there is Hetu 7, then there is Vata Prakop, then Rukshata, Parushata, Kharata, then there is Vayu Puran, then Vata Sangha happens, and then this is called Sandhigata Vata. So there is always an MCQ on these, that Vayu Puran and Vata Sangha are 2 important signs of what disease. So you will write there Dhatukshayajanya Vatavyadhi, Sandhigata Vata. Okay, not Vatavyadhi, but Dhatukshayajanya Sandhigata Vata. So now we will see what is Strotorod Pradhan Sandhigata Vata Samprapti. So in the Strotorod Pradhan type also, there is Hetu 7 first. Always there will be Hetu 7 first, and then it will lead to Kapha Prakop or Amadosh Utpatti. So the Hetu 7 leads to Kapha Prakop and Amadosh Utpatti. Why? Because of the Shita Guna 7. So this Kapha Prakop or Amadosh Utpatti will lead to Srotorod. There will be Avarodh of the Srotasas. There will be obstruction. So then Vata will become Vimargag. Vata has to go somewhere, but if there is a obstruction in its path, then it will go somewhere else, right? So that means it becomes Vimargag. Now the Samvayu gets Sthana Sanshraya at the site of Sandhis. So at the place of joints there is Sthana Sanshraya of Samvayu. Which Vayu? Samvayu. So this is also an MCQ, important MCQ, that which Vayu gets Sthana Sanshraya at the Sandhis. So it is Samvayu. And then this leads to Sandhigata Vata. So the Srotorodh Pradhan Samprapti, when you have to write, there is always an Avrodh and Samvayu gets Sthana Sanshraya. So both these Sampraptis are different. The main happening in this Srotorodh Pradhan Sandhigata Vata is that there is Kapha Prakop and Amdosh Utpatti, and also the Samvayu gets Sthana Sanshraya. The Vayu becomes Vimarga, the Samvayu gets Sthana Sanshraya, and then it leads to Sandhigata Vata. So now if you need to write it for an SAQ, you have to write both the types. If they ask you just Samprapti, then you have to mention both the Sampraptis. If they just ask you about any one type of Samprapti, then you are good to go with just one type of Samprapti. But if it is not specifically mentioned, then both the types of Sampraptis you have to write. If it is an LAQ, then from the starting, from that shloka itself, you will have to start writing everything. The shloka, then what is the main symptoms, the Samprapti, the causes and all, everything. Then for the LAQ you will have to write. But for SAQ, at least both the types of Sampraptis need to be mentioned for 4 marks, 5 marks. So Sandhigata Vata is the most commonly seen Vatavyadhi out of all the types. So all types of Vatavyadhis there are, the Sandhigata Vatavyadhi or Sandhivata is the most commonly seen Vatavyadhi. Also it is mostly seen in old age. We generally do not see this Vyadhi in young people. It is mostly seen in old age people. And Nirupastambhit and Upastambhit, both the types are seen in this Vatavyadhi. So this is also another MCQ, that Nirupastambhit and Upastambhit types both are seen in which type of Vatavyadhi. So it is Sandhigata Vata. Okay. Now Sandhi Shul, that is the pain in joints, and Sandhi Shodh, that is the swelling in joints. So like I said earlier, pain and swelling, both these are the most important symptoms of Sandhigata Vata. Now the movement of joints causes a certain sound. There is a kind of sound when you move the joints when there is Sandhivat. The joints, if you touch the joints, they feel as if air is filled in the joints. So because of the swelling, that feeling is there, that the air is filled in the joints. This is a typical symptom of Sandhigata Vata. Also it is described that joints get destroyed. That means they don't literally get destroyed, but that means that there is a restriction in the joint movements. That means there is Kriyalpata, a lot of Kriyalpata, lesser or a restricted movement is there. So Alpa is less, that's why it is called Kriyalpata, that there are lesser or restricted movements. Also there is sometimes Kriya Hani. Hani is complete stoppage or loss. So there is a stoppage or loss of movements completely sometimes. Also all possible movements are painful. Whatever movements are possible, they are also very painful, and any joint in the body can get affected with this disease, but mostly this disease is seen in the big joints as the starting point. So mostly the big joints are affected first, so big joints are the starting point for this disease. So this is an important difference in Sandhivata and Amvat. In Amvat, whereas we see that the smaller joints are affected first and then it spreads to the bigger joints, but in Sandhivata the bigger joints are the starting joints and then it spreads to other joints, but it can affect any joint in your body. So a few MCQs can be seen here, that this is the most commonly seen Vatavyadhi. This is one MCQ. Then when does it occur? It usually occurs in old age. This is another MCQ. Then Nirupastambhit and Upastambhit, both the types are seen. This is one more MCQ. Also Sandhi Shula and Sandhi Shodh are the important symptoms of which Vatavyadhi. If you are asked like that, then Sandhigata Vata is the answer. Also Kriyalpata and Kriya Hani are the symptoms of which Vatavyadhi, then Sandhigata Vata is the answer. And then which joints are affected? So any joint can be affected. And what is the starting point? So mostly the big joints are the starting point. So these many MCQs can be framed alone in this single page only. Now specifically for Upastambhit Sandhivata, there is acute tenderness or Sparsha Sahatva at the Sandhi Pradesh or the joints. So there is an acute tenderness, there is Sparsha Asahatva. We cannot tolerate the Sparsha, that is the the touch. Even the touch is not tolerated. So acute tenderness is there at the Sandhi Pradesh. There is Arakta Varnata. Arakta is redness and Varna is color. So there is the redness of that place where the joint is affected. Then there is Ushna Sparsha, that means elevated temperature at the site, and sometimes fever also is present. So this is peculiarly for Upastambhit Sandhivata. Now Upastambhit Vata and Amvat, they seem very similar to each other, but they are very different. That's why the differential diagnosis is very important. And what is the differential diagnosis between Amvata and Sandhigata Vata? So in Amvat you will always see that there is Sanchari Vedana, that is radiating pain is there. But in Sandhigata Vata, Sanchari Vedana is never present. There is no radiating pain. The pain is at the site of the affected joint only. It does not radiate to any other place. So you can be asked the differential diagnosis between Upastambhit Vata and Amvata for 2 marks. It can also be asked for an MCQ, that Sanchari Vedana is a typical symptom of which Vatavyadhi. So you will say, write that there is Sanchari Vedana in Amvat, not in Sandhigata Vata. So these kinds of MCQs are usually asked. Then what is the Chikitsa for Sandhigata Vata? We'll see that, alright. So Bahya and Abhyantar, 2 types of Chikitsa we'll have to see, that is external and internal. So for Bahya and Abhyantar, both types we'll be using Snehan, Swedan, Lep, Anuloman, Raktamokshan, Dahan Karma and Shamanopachar. So these are general guidelines for the treatment of Sandhigata Vata, and this type of treatment is extremely important for treating Sandhigata Vata. So what should be done? There should be Snehan, Swedan, then Lep, Anuloman, Raktamokshan, Dahan Karma and Shamanopachar. Now Snehan and Aushadhi Kalpa, they will differ according to the type. If it is Upastambhit or Nirupastambhit, so Snehan and Aushadhi Kalpas will be different according to the different types. But Mrudu Anuloman, Lep, Dahan Karma and Raktamokshan, these 4 things are same for both the types. So even if the Aushadhi Kalpas and Snehan will differ, but the Mrudu Anuloman, Lep, Dahan Karma and Raktamokshan, these will be same for both the types. So an MCQ can come on this also, that these 4 kinds of treatments are same for both types of which Vatavyadhi. So it is Sandhigata Vata. Okay. Alright, so now let's see what is the treatment for Dhatukshay Janya, that is the Nirupastambhit Sandhigata Vata. So the Chikitsa is given below. So for Bahya and Abhyantar, the Snehan is very important. So external and internal oleation both are very important in the Dhatukshay Janya type. The oleation should be done with Narayana Taila and Bala Taila. And for Vedana Prashamana, that is relieving the pain, the Snehan and Samvahan, that is oleation and massage. Samvahan is massage. So it should be done with Vishagarbha Taila. So this is also an important MCQ, that what is Snehan is important in which type of Sandhigata Vata. So for Dhatukshay Janya it is extremely important, and for Vedana Prashaman, which Taila is used in Sandhigata Vata, so it is Vishagarbha Taila. Okay. Now Svedana at Sandhi Pradesh, that is joints, the fomentation is extremely important. It can be done with Tapasved or Bashpasved, and also Nadi Sved with Nirgundik Vata and Nadi Svedan Yantra. So with the help of Nadi Svedan Yantra, the Nadi Sved is done with the Nirgundik Vata, and the Tapasved and Bashpasved are also given. Svedan is to be done at the joints at the Sandhi Pradesh. Alright, so now here are a few treatment methods, the Lepa and Raktamokshan etc., which will be same for both the types, for Dhatukshay Janya and for Upastambhit. For both the types, this treatment methods will be same. So for Lepa, we'll be using Bachanag, Dhattura and Tentu Lep. It is also known as Hara Lep or Green Lep. So Bachanag, Dhattura and Tentu, the Lepa is prepared and applied at the site of the joints. Then the Lep Kuri or the Shanga Lep is also used. Then Sambar Sinki, Daru Haldi, Fitkari and Rakta Chandan. These 4 combined also we have to make a lep and apply. Then for Raktamokshan, the Raktamokshan is to be done from the Sandhi Pradesh. So for that 50 ml of blood, that is Rakta, is to be taken out from the veins or the siddhas near the joints, and this is known as Sadhya Phaladai Chikitsa, so which gives immediate relief. Sadhya Phaladai, it is successful immediately, so that's why it is very important in Sandhigata Vata. Then for Dahan Karma, at the site of extreme tenderness, wherever there is extreme tenderness, at that site Dahan Karma is done with Bhallataka Taila. Also Dahan Karma, after applying Bhallatak Taila, is to be done with the help of a Swarna Shalaka. Okay, and if there is pain at many joints, many different joints, then Dahan Karma is to be done at the base of the thumb of the right hand. Okay, so Angushtamula of the right hand, that is the base of the thumb of the right hand, that is the place where you have to do Dahan Karma if there is pain at many joints. Okay, also there is Mrudu Anuloman with Erenda Tail and Gandharva Haritki. So this is to be done in both the types. So if you get a question for SAQ like 4-5 marks, if it is for a single type, then also you have to include this. In any type you can write this, both types it has to be done. And if there is an LAQ which includes both the types of Chikitsa, then also you have to write this. This thing has to be mentioned because it is common for both the types. Also, a lot of MCQs can be asked on this page alone. So, why is Raktamokshan, the Sadhya Faldai Chikitsa? So, in which Vatavyadhi? So, it is in Sandhigata Vata. Then Dahan Karma is done with which Tela? So, it is Ballatak Tela. Then it is done with Swarna Shalaka. That can be another MCQ. Also, if there is pain in multiple joints, then where do we do the Dahan Karma? So, it is at the Angushtamula of the right hand. So base of the thumb, and also Mrudu Anuloman. So these many MCQs can be asked on this page. So it is an important page to learn. Now as for the Aushadas for the Dhatukshayjanya type, so the Aushada that we use are Bhallatak Parpati, Bhallatak Asa, Maharasna Dikwat, Trifala Gugul, Amruta Gugulu, Kaishor Gugul and Rasna Gugul. Samir Pannag is there and Lata Karanj is there. Lata Karanj is used specially for Shotha and Vedana, for swelling and pain. So Bhallatak, both the Aushadas you can remember together, Bhallatak Papati and Bhallatak Asa. Then there are 4 types of Gugul we use: Trifala Gugul, Amruta Gugul, Kaishor Gugul, Rasna Gugul. And how should be the Ahar? The Ahar should be Laghu Anabhishandi, and Kulathayush is to be given. Also Rason, that is garlic, is to be used every day. So Aushadas are these many, and Ahara is like Laghu Anabhishandi, Kulathayush is to be used, and garlic is to be used. Alright, so let's see the Chikitsa for Margavrojanya, that is the Upastambhit type of Sandhigata Vata. So in this type, Abhyantar Snehan is totally contraindicated. This is an important MCQ. Abhyantar Snehan is not to be done in Margavrojanya Sandhigata Vata, or Abhyantar Snehan is not to be done in Upastambhit Sandhigata Vata. Okay. Bahya Snehan also is not to be done. Only there is an exception that Vishagarbha Tail can be used if the pain is too much. So as a Vedana Prashaman, Vishagarbha Tail can be used, but that is the only exception. Otherwise, Abhyantar and Bahya Snehan are not to be done in Margavrojanya Sandhigata Vata. Svedan can be done. Svedan is to be done at the Sandhi Pradesh. Tapasved or Bashpasved again, the same as the previous type. And the Nadi Sved is to be given with the Nadi Svedan Yantra and Nirkunti Kwat. So this part is the same for both the types. But other than that, Snehan is not to be done. Okay, and for the lap and etc., like I told you, the previous page, the one that I have written in green, so that page is to be written for if the question for Chikitsa comes for any of these types. So for both of these types, you have to write this green page along with this Chikitsa. Okay, so somehow you will have to remember whatever is written on that page with the green that I have written, because once you learn it just once, you can write it for both the types. Okay. Now for the Aushadha part, so here is Yograj Gukul, Mahayograj Gukul, that is easy to learn. Then there is Ashwagandha Rishta and Shatavari Kalpa. Ashwagandha and Shatavari usually go together so that you can remember easily. Then there are Suvarna Kalpas, so Suvarna Samir Pannag, Suvarna Kalpas are to be used. And then there is Chintamani, Bruhatvat Chintamani and Trailokya Chintamani. So if you pair this up like this, it will be easier for you to remember. And the kalpas are different in that type and this type, so just don't mix up. You cannot write those kalpas here and these kalpas there, so they are different and they are to be written differently. Now for Samir Pannag, when there is Kafanubandha or if there is Vat Prakop at any Kafasthan, we use Samir Pannag. So Sandhi is a Kafasthan, right? You know. So this is also in another MCQ, that Sandhi is a Kafasthan or Pittasthan or Vatasthan, and usually we do the mistake of writing Vatasthan because we know that sandhis and joints and bones and this and that, they are usually related to Vata as we are writing them down in Vatavyadhis. But no, Sandhi is a Kafasthan, and that's why we use Samir Pannag here, because wherever there is Vat Prakop at Kafasthan or if there is Kafanubandha, we use Samir Pannag. That's why Samir Pannag is mentioned here. Okay, now according to modern science, Sandhigata Vata can be compared with simple inflammatory arthritis. So this is just for the Ayurveda part of the Sandhigata Vata. That's why we are not going into details with the modern part. We'll cover that in some another video. So in this video we have seen how we will write the answers if we are asked the question about Sandhigata Vata for 2 marks or 4 to 5 marks or 15 marks even. So if you get Sandhigata Vata for 15 marks, then from the starting that shloka Vata Purna Dhruti Sparsha, from that shloka, right from that shloka till the very end, you have to write everything for 15 marks. You will write the hetus, the causes, you will write the difference between both the types, also the chikitsa of both the types, the samprapti of both the types. All these you have to write if you get a question for 15 marks. Now if you get for a short answer question like SAQ, like for 4 to 5 marks, then for that you just read the question carefully. If they do not ask you about a particular type of Sandhigata Vata, then both are to be mentioned, but then you have to cut short somewhere. But if they ask you for any one particular type of Sandhigata Vata, then you can just mention about that, only that type. But always start the part of Sandhigata Vata with the shloka or what is Sandhigata Vata, so that shloka will help you do that. Alright, so I have tried to compile this big topic into some small and concise notes. I really wish that these notes help you. If you like these audio notes, then please do not forget to like, share and subscribe to this channel. Also please recommend this channel to your friends and classmates. And if you don't like the audio notes, then also there is no problem. You can just mute the audio of this video and then you can use these notes as simple video notes. So I'll see you soon with the next video, and the next video will be about Akshepak, Apatantrak, Apatanak and Dandapatanak. So I'll see you soon with the next video in the English Vatavyadhi series. So until then, bye bye and take care.